What's up guys, welcome back to my YouTube channel. Today, as it says in the title, I'm going to be talking about my surgery placement. Okay, so I'm currently in the second half of my fourth year of medical school, and at my university this is when we start the clinical segment of the program, also known as the best part. And I say that because despite the fact that I've chosen to stay in school longer than the average person, I don't like the whole cycle of going to class from 9 to 5 or 7 and having to keep up with work throughout the week, only to procrastinate for the exam period and then stress out over procrastinating and not studying well enough, and then, doing the exam and passing by the skin of your teeth. I feel like it's become too repetitive at this point. So my first rotation was surgery, and it lasts for 17 days or just under a month. And in short, it was amazing. Like, it was so interesting. I got to be with different surgeons from different specialties. I got to be with anesthesiologists. I got to work with some nurses as well, and it was just really interesting. I was able to see some surgeries, from minor ones like removing the mole from the skin, or major ones like hysterectomies where they take out the uterus, or prostatectomies where they take out the prostate, right? And that was actually the most interesting surgery that I saw. Okay, so I'll talk about that a bit, right? So for the prostatectomy, they have this new robots that have like 4, 5 or 6 arms that go over the patient while he's lying on the surgery bed, and the surgeon is at a different control unit where he has a joystick and a monitor in front of him where he's looking at the insides of the patient through one of the arms, which is a camera, and then he's cutting different parts and stitching up different parts from the control unit. I thought that was crazy. It was mind-blowing to see. It's the first time I had seen any surgery like that, and it was still the best experience I've had besides seeing a live birth. And yeah, it was crazy. It lasted, I think, 4 hours, but it was definitely worth it to see something that's relatively new to the field as far as I'm aware. But yeah, so that was crazy. And I also got to work with anesthesiologists. I saw how general anesthesia is administered, and anesthesiologists are some of the best people that I got the chance to work with. Every single one of them were really nice and so helpful. And can I just say, anesthesiology is a lot more difficult than I thought. I knew a bit about it before. I knew it's the process of giving general anesthesia while someone is prepped for surgery, but I didn't realize how much chemistry and pharmacology went into it, and just how much they have to actually know. They have to know so many drugs, so many drug interactions, dosages, formulas. As much as I love math, I don't like chemistry, I don't like pharmacology. So needless to say, that's not a field I'm going to be going into. Also got to speak to different patients either before they had the surgery or after the surgery. So before they had the surgery, maybe it's the first time they were coming in for a consultation, or it was the consultation with the doctor before they are going to go in, and just seeing the doctor give them information about the surgery or giving them options of which procedure they would like to opt for, and also seeing their reactions, seeing how they were taking it. It was something new, considering that all of my other prior knowledge about the hospital has been basically in the classroom. I haven't really had the first-hand experience. I've done some shadowing before, but it wasn't really the same. Got to talk to them after the surgery, assess their consciousness, take a history if I hadn't seen them before, and it was all just really good to see different parts, just how they all come together. So going into it, I'm not gonna lie, I was a bit anxious because I felt like I wasn't prepared, like I hadn't studied enough or knew enough of the material that I've covered so far to go into the hospital, right? And I'm sure some of you who haven't yet gotten to that stage are definitely going to feel like that as well. I know the people above me that I spoke to, some of them also felt the same way. And I think it's completely normal. It's the first time that we are going into the hospital as medical students full time, and you're obviously going to think you need to know every single disease that you've learned. You need to know how to take history from anyone and get to diagnosis straight away. But as I went along, I found out that there wasn't really much to stress about at this stage anyway. Like, it's our first leg in. A lot of times the doctors would either like assist you if you forgot something, or you figure out that you actually know a lot more than you think. All those hours of communication skills and clinical skills that you've been doing over the years, it becomes like muscle memory. You don't realize that you know them until you have to implement them in practice. And like I said, even when you don't remember certain things, the doctors are there to either help jog your memory or just help you out. And they're more than willing to teach as well. Like, a lot of them are more than willing to teach. Obviously, they're human beings as well. It's gonna vary from doctor to doctor. But all in all, I found that a lot of them, majority of them anyway, were very helpful. And sometimes the doctors or the surgeons might also try testing your knowledge. They could ask you a question, and if you don't get it right, you might feel like crap. I know that happened to me a few times. Like, they would ask me a question and I wouldn't remember the answer, and I'll just feel like shit. And I felt like that was a good thing, because I would be worried if I wasn't feeling like shit about the fact that my knowledge was lacking in certain areas. And if anything, that just motivated me to want to study even harder, to want to, compensate those areas where I haven't necessarily studied as much. Like, every week I always had a list of topics that I maybe flopped a question on that I went back to go and study. Sometimes I didn't study it because I was just being lazy, but a lot of the times, like, it helped me still keep up as I was going along. And we're not expected to know everything at this level. A lot of the things that we've been doing has just been the foundation, the theory. And when you go into the hospital, you get to build on top of that with the practical part of it. And I can say, just from the 17 or 3 weeks to 4 weeks that I was in the hospital, I remember a lot more from that than I do from the 3 months of theory or whatever that I did at the university. But they also played a role in giving me that base understanding. The practical helps you apply the theory, and then it all comes together and sticks. So yeah, I really think it's something to look forward to and to be excited about. Let me know in the comment section if you guys are going to your clinical rotations, or if you have had your clinical rotations. What were you most excited about? What were you most worried about? Yeah, see you guys in the next video.